Hello, and welcome to the Regional Health Report. I'm Ann Krebs. This monthly program highlights the world-class health care provided at each of our Regional Health Command Atlantic medical facilities, dental clinics, and public health units to soldiers, their families, retirees, and other beneficiaries. Some beneficiaries who come to us for care have complex needs that require multiple medications. When patients take 4 or more of any type of medication, it's called polypharmacy. The Army is working to lower the risks of polypharmacy by partnering physicians and pharmacists to ensure safe drug interactions. Adding patients to the team means care that matches the person's needs. Jerome Banks visited Fort Meade, Maryland to learn more.
The Army is using additional education and training to lower the risks of polypharmacy. Facilities like Kimbrough Ambulatory Care Center see patients on high-powered pain medications or drugs that affect a person's mental state, and those who have made 3 or more emergency room visits in the last year.
We're very lucky to have a clinical pharmacy technician here, so she'll reach out to those patients, call them and ask them to schedule an appointment, kind of explain a little bit about what the appointment is going to be about, and then we typically have them come in and see us face-to-face for an appointment in the clinic.
In the initial appointment, GLAD goes over every medication the patient is taking. That includes prescriptions from physicians or over-the-counter medications.
I'm talking about specific dosing, how often they're using it, if they're using anything over-the-counter, maybe because their prescriptions aren't giving adequate pain control. And then as part of the process, each time they follow up with us, we'll review any changes that may have been made, or if we added any medications, how those are working for them, or if they're having any side effects.
Pain is the most common reason patients see their doctor. Jennifer Story wants to manage her pain without feeling over-medicated. Her doctor and GLAD work with her to find a balance of medication and alternative treatments to achieve the quality of life she wants.
I met the doctor and the pharmacist here, and they listened. I thought that was my biggest thing. They listened. I was desperate. I didn't want just pumped with all these medications. They listened to my needs, and I think everybody has a personal need and so needs to be listened to.
Listening helped the team suggest alternatives to medication, like acupuncture. More than 116 million Americans suffer from chronic pain. Story recommends programs like the Pain Management Clinic as a means to deal with it.
This few months that I've been working with her has been like a godsend to me. I was getting to a stage I was desperate, and I would recommend what I'm getting done now 100%. 100%.
For the Regional Health Report, I'm Jerome Banks.
When patients get clinically appropriate medications that help their symptoms while reducing drug interaction risks, the entire Army family wins. It also helps keep soldiers medically ready to deploy when the nation calls. Many of our popular ideas of healthcare involve trauma medicine and surgery. But for many patients, the emergency room or the operating room is only the beginning. Next, we bring you a story of a patient who is well on her way to recovery, thanks to the occupational therapy team at Wynn Army Community Hospital. Katrina Curtis reports from Fort Stewart, Georgia.
I'm doing all right. I got my pain meds in.
Dina Smith was in an accident where she suffered extensive injuries to both of her arms. Originally, she participated in occupational therapy at home, but wasn't seeing any progress.
They said it wasn't getting any better, so they wanted me to come on base to be able to get more extension and movement in my arms since I had the accident.
Elena Burden-Force was the occupational therapist who evaluated Smith when she arrived at Wynn.
We received Ms. Smith with having extensive traumatic injuries to both of her arms. She has sustained bilateral humeral fractures to her right and her left arm, and as well she has sustained a radial nerve palsy injury to her right arm as well, which has not allowed her to have any type of movement in her forearm, her wrist, and her fingers.
Force explained to Smith that the journey back to complete functionality will be an arduous one.
They talked to me and told me what they were going to do, and it was going to be a long process.
One of the first hurdles that Smith had to overcome was her fear of pain.
You could tell that she was quite fearful, and that was just mainly not expecting what was going to happen on her first appointment and just having a lot of pain issues.
Staff Sergeant Tiara Jenkins worked alongside Burden Force to help Smith grind through her problematic areas.
Pretty much our goal is just to get her initially just to start really moving well.
Got it.
Smith's treatment started out with exercises that improve mobility.
We're working on that indoors today.
When I first come in, I couldn't even lift my arm that high. And now I'm way up here.
For individuals who haven't sustained an injury as severe as Smith's, they may not understand the daily battle Smith goes through just to do something as routine as getting dressed for work.
Especially when you're an adult who's lived so many years and you're used to your routine and you're used to those habits that you've set up, and then all of a sudden you have something happen to you that prevents you from relying on those.
Since starting her therapy, Smith has seen a difference.
I thought I was never going to be able to move my arms again and everything, and they brought my spirits up and everything, because I actually look forward to coming to physical therapy.
For Wynn Army Community Hospital Public Affairs, I'm Katrina Curtis.
Finally, through this program, we share a lot of what Army Medicine is doing for beneficiaries in our region. Now it's your turn to have your say. Regional Health Command Atlantic facilities are taking part in JOES, the Joint Outpatient Experience Survey. JOES gives the Department of Defense a great way to learn your opinions on how your hospitals and clinics provide care. JOES focuses on quality of care, the timeliness of appointments, and courtesy. After each visit, you'll receive a survey by mail or email. Fill it out and take part in shaping your healthcare experience. And that's the Regional Health Report for October. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on Facebook, Twitter, Pinterest, and YouTube. Thanks for joining us.